Now I want to share how we add value of healthcare system through technology, a One Health perspective. A One Health approach, as World Health Organization is branded, it is the work designing and implementing programs, policies, legislation, and research in which multiple sectors communicate and work together to achieve better public health outcomes, hopes that can attain optimal health for people, animals, and environment. A One Health fact pervades the world of health, food safety, the environment, and economy. We can see that most pathogens cause human diseases, and emergent human pathogens are animal origin. Forest destruction makes humans more likely to encounter wildlife. This context may increase the likelihood of disease transmission. Animal disease also cause animal production losses, starvation, and food safety problems. It also directly threatens the incomes of rural people with economic consequences. Microbes, animals, and humans share the ecosystem we live in. Efforts by just one sector cannot eliminate the problem. Health is no boundary between all sectors. Zoonotic diseases are caused by germs that spread between animals and people. Close connection between animal and human make zoonotic diseases spread frequently, such as rabies, avian influenza as we know it. Prevention and control of animal diseases are closely related to human health. COVID-19 pandemic from 2019, a human public health crisis resulting from a virus of potential animal origin. It makes us aware of the importance of the One Health concepts in facing global health risk and challenges. The areas of One Health approach. The areas of One Health approach are particularly relevant in food safety. I have to see your screen. Yeah, okay. The control of zoonosis, environmental health, and antimicrobial resistance. For the healthcare system, we can directly efforts on curbing the silent pandemic of antimicrobial resistance. And next, thank you. Antimicrobial resistance occurs when bacterial, viruses, fungi, and parasites change over time and no longer respond to medicines. It causes the infections harder to treat and increasing the risk of disease spread, severe illness, and death. One of the facts is that the resistance to TB drugs can cause around 10 million people to fall ill and 1.6 million to die every year. In 2019, WHO has declared that AMR is one of the top 10 global public health threats to humanity. Next, please. Yes, thank you. Let us see what's the causes of AMR. We can see that the overuse and misuse of antibiotics in medical, which include patients not finished treatment, are the main drivers in the development of drug-resistant pathogens. Even include the overuse of antimicrobials in livestock and fishing farming is one of the reasons. Lack of clean water, poor sanitation, and inadequate infection control causes the spread of microbes, some of which can be resistant to antimicrobial treatment. Lastly, as bacteria mutate over time, effective antibiotics will decrease, and lack of new antibiotics is also a big problem. Next, please. There are two main ways in which resistant bacteria can be spread. First, the antibiotics given by doctors, the drug-resistant bacteria were developed in guts. which while people went to hospital or clinical, the AMR might be spread through poor hygiene and unclear facilities. The other way, the overuse and misuse of antimicrobials in food-producing animals and crops. The drug-resistant bacteria will be developed in animals. These bacteria reach humans through food, the environment, and direct human-animal contact. While the food-producing animals are the drug-resistant bacteria spreads to the general public. Next, please. I would like to share about how we use technology to improve the healthcare and what we have done to prevent AMR. I'm going to start from a brief talk about our national health insurance system in Taiwan. This system has been implemented from 1995, 27 years from now. It is a single-payer system run by government, covered medical care for all citizens. National Health Insurance Agency holds complete records of insured, include medical, traditional Chinese medicine, dentistry, and related details. Next, please. Thank you. There are multiple approaches in our strategy to promote the judicious use of antibiotics. In our medication payment rule, we request doctors to prescribe first-line antibiotics at first, in addition to treatment, according to the bacterial culture, and antimicrobial susceptibility results. We use antibiotic appropriate in outpatient and over 3 days after clean surgery indicator to allocate global budget. We decline the claim in reimbursement when the prescription rate exceeds a specific number. Through these measures, clinicians are encouraged to improve the judicious use and improve the quality of care. Next, please. How we adding value of healthcare through technology. Next slide. It's a glimpse of our tender technology triangle. The National Health Insurance Administration hosts the claim data, medical images, lab tests, and images reports uploaded from medical institutions. It's a precious real-world database. We have MediCloud in the sky and My Health Bank app for medical provider and public to help providing better care. Next slide shows that the NHI MediCloud system is actually a platform to exchange medical information across its medical institutions. The system gives a warning while doctors give duplicated orders, prescribe drugs interactions, and fund allergies prescription. Medication safety is dramatically improved when these reminders are available. Next, please. This slide shows us the benefits of MediCloud. The MediCloud system can avoid information discrepancy caused by recall or expression bias, help communicate between physicians and patients, avoid duplicate medication or exam duplication, not only reduce medical expenses, but also ensure patient safety. It provides physicians with useful information to facilitate appropriate and proper diagnosis. Next slide, I am going to explain the MediCloud system is a utility solution to reduce the misuse of antibiotics. Doctors can check patients' medication easily to make appropriate diagnosis of antibiotics therapy. It could help reduce overuse of antibiotics and the patients to complete therapy with correct medicines, correct dose and duration. Next slide is about the NHI app, there is a My Health Bank, a platform in this app. My Health Bank system provides people to review and download their personal health records on their own mobile device. It's not only encourage self-health management, but also help users to communicate with medical providers, make physician and patient shared decisions possible, and thereby improve safety and quality of medical care. People can check their prescription and discuss the appropriateness of antibiotic use with their physicians if necessary. Yes, and next slide. My Health Bank in response to COVID-19. In response to COVID-19 pandemic, we used the My Health Bank app. We introduced the COVID-19 rapid antigen test and PCR test result, and people can check the result and demonstrate the results to others, and COVID-19 vaccination records, and provide link to self-reporting system for COVID-19 confirmed cases. My Health Bank became a one-stop services or platform to assist the epidemic prevention and the management for the government and also for the personnel. Next slide, please. Yes, the NHI big data can be shared for academic use. There are some researches I'd like to share with you. For example, a long-term surveillance of antibiotic prescription shows us that the defined daily doses of cefepime, impepanan, ciprofloxacin were increased, and the antimicrobial sensitivities of ACP and the Aeruginosa was decreased in Taiwan. It is an iron evidence that the bacteria become drug resistant with time. And the paper and the study emphasize that the surveillance of antibiotic prescription and the prevalence of the emergent resistance in nosocomial infection is warranted. And the other study shows us after National Health Insurance Administration policy to restrict antimicrobial use, the H. pylori bacteria become more resistant in levofloxacin, but the primary resistance in clarithromycin, metronidazole were decreased. The policy affects the reduced consumption in certain antibiotics. It is important to surveillance of antimicrobial resistance and the proposed further strategies of the results. Next slide, please. As we see how the National Health Insurance Administration use digital technology to prevent AMR, it shows the potential of IT system and big data in facing the public health challenges are very useful. The use of technology can also make public services more efficient and more convenient. We create a real-time, accurate, and complete database, which integrate multiple agencies from Taiwan CDC, Taiwan National Health Promotion Agency, and the National Health Insurance Agency. And in the future, maybe we'll integrate the Taiwan FDA data. Might be a great tool. It assists rapid and comprehensive monitoring of drug-resistant pathogens, antimicrobial use, and new zoonotic diseases. Certainly, the main point that we should integrate capability across disciplines, sectors, and the communities to face the One Health challenges and working together for global health. This is all I have. Thank you very much.